I don't want to rant too much, but I just want to mention some missed opportunities in the healthcare system that I experienced. I'm not going to rant. So the first one is that I didn't know as a new mom, and most new moms that I talk to don't know, that nursing is not just about the milk.
Yes. Oh, you're so smart. I didn't know you were going to talk about this today.
Oh, yeah, because this just blows my mind. How did I have 2 babies and never learn this? Okay, so it's fascinating to me. Anyway, so if this were common knowledge among the numerous people who interface with new moms, could you imagine the difference that would make? I mean, my pediatricians never said anything.
Yeah, the whole formula versus, milk, like breast milk, is the discussion. Nobody talks about the muscles and the oral development and the swallowing and that, coordination that babies need that they miss if they bottle feed, even if it is, breast milk put into a bottle.
Right. Nobody. And I will say I never had a lactation consultant, or I probably had one in the hospital. I never had one, at home, but I know a lot of people who did, and they still didn't know this.
Mm-hmm.
So I don't know what's going on. I really don't have answers for that. And then the mouth breathing part. I mean, as I had mentioned before, our private speech therapist was the one who pointed it out. But I think that the pediatrician should have pointed that out when he was 2 years old or 3 years old. I mean, that to me is kind of unacceptable.
Mm-hmm.
I can't believe this. It's such basic information. Anyway, so that just gets me crazy.
I agree. I'm always like, it should be like parenting 101. Like every parent should know, like kids shouldn't be breathing through their mouths, or else it's a sign like something's not right. It should be like a red flag to all of us, but we're like, oh, it's fine.
Yeah. And then, how long had the acid reflux been going on? Why did it begin as the result of mouth breathing? Like, how much damage has it done? And was it the source of the inflammation in Lucas's nasal cavity?
Mm-hmm.
I don't know.
It can even cause large tonsils and adenoids too, because of that acid and the inflammation. So it is all connected.
Right. And then the teeth grinding. So I've heard, and you can probably confirm this, I've heard there's different reasons for it, but in the book 6-Foot Tiger in a 3-Foot Den by Dr. Lau, he argues that when the tongue doesn't have enough space, it falls back into the throat during sleep, which we know. And that tells your body that it needs to do something. So the clenching and the grinding serve the important role of opening the airway again. That's his argument. And I mean, I don't know. I tell people that, because a lot of people teeth grind and they say, oh, I'm a teeth grinder, and it's like, oh, well, that's kind of serious.
Yeah, you're right.
So, I mean, this is just like this was all so revelatory to me. I mean, I don't know. So, and then the assessment of the quality of sleep. So I wish that at least one of the pediatricians that we had seen over the years had asked me about his sleep. And I don't mean like, does he get to bed on time? Because I think that's probably the only question that was ever asked. I mean, like, is his mouth open at night? Are his sheets and blankets all over the place each morning? Does he snore ever? Does he seem tired during the day? How is it that the neurologist that we did see last year or 2 years ago, who's a pediatric headache specialist, didn't ask a single question that may have led her to conclude that Lucas has obstructive sleep apnea? Mm-hmm. I really can't wrap my mind around that either.
Yeah, it's so crazy.
And then I think, and then the psychiatrist, in an ideal world, I would just say that it would be standard practice for a child psychologist or psychiatrist to rule out adrenal overload, which clearly was going on.
Mm-hmm.
So needless to say, it took us a long time to connect all the dots, but and this was something I was saying earlier, the vast majority of parents are not going to connect them at all, because there's a huge mismatch between the patients who need to address this and the practitioners who work within this paradigm.
And it's hugely time consuming. I mean, think of all the hours of research you put into this to learn this, and all the time and all the appointments. It's not everyone has all that time and energy.
Yeah, I did. I think I must be missing a slide or something, because I remember talking about that in this presentation, that, why did it have to take this amount of work? I mean, I would say 95% of parents or more just don't even have the wherewithal to deal with this.
Yeah.
It's kind of, it's really mind blowing. So, pretty much I will conclude my presentation with this quote I really like.
Mm-hmm.
Can we apply dentistry's preventative model to overall health to improve life quality and longevity? Can we copy and paste dentistry's success in saving teeth onto America's healthcare system? I believe we can, and the numbers say we must, but that requires having new eyes to see the mouth's pivotal role in total health.
Oh, that's an awesome quote.
So, yeah, I like it a lot.